We have Dr. Gertie Chimeka Anyanwoke, an infectious disease specialist, and she joins us from Baton Rouge, LA, in the United States. Thank you for joining us on the program.
Thank you. I appreciate you having me.
I'd like to begin with how the United States is handling the daily cases of the virus, seeing as it is still #1 in the world.
Yes, it's really been a roller coaster over here, but we think that it's beginning to get better. However, we just came out from the Labor Day weekend. It'll take hopefully a few days, maybe a week or two, for us to see if what people did impacted in our general experience of the COVID-19. But the numbers seems to be coming down, although not at levels that we would have preferred. We keep trying every day.
Tell us about compliance levels. Are they better? And if you compare that to perhaps some of the figures you're seeing coming from Nigeria, we recorded the lowest cases in about 5 months. And what do you think we're getting right?
I think that the case of Nigeria, in terms of people listening to what's being said, some people are and some people aren't. Generally, it hasn't really hit Nigeria hard the way it was expected. And I think that we need to do further studies. We need to do researches for us to find out the real reasons. My guess would be that the Nigerian population is much younger and with less comorbidities, meaning other medical problems. So even if the seroprevalence is high, meaning even if a lot of people have the coronavirus, they may have no symptoms at all. And so it looks like it's not really affecting the people the way it should. In America, however, the challenge has really been because there's no national strategy. So it's like there's piecemeal and every state for themselves. And a lot of times, even in a state, a city might do one thing and another city is doing another thing. And so it's just varies. And when stuff impacts one state, just because the fact that it's a country where people are free to move from one place to the other, it's going to keep doing the same thing it's doing right now. Unless we have a national strategy, I don't see this abating anytime soon in the United States.
So
unless, of course, when we get the vaccines.
Yes, and that's what I was going to ask. Going forward, as an infectious diseases specialist, what advice would you give to Nigeria, the United States, governments around the world as to how to get control of the virus?
Well, I think the same advice we've been given. We would like to keep advising and advocating for all those measures that would like to flatten the curve, which I think literally most countries of the world are doing, which is the social distancing within 6 feet or 2 meters, wash your hands frequently, use hand sanitizers, cough with tissue, all those measures still will help us. And of course, countries should begin to position themselves to be able to get this vaccine to kind of help the population get to the point where it can prevent most of those patients that are at risk from even dying from this coronavirus. So that would be my advice. The same things we've been saying. In Nigeria, I'm not sure about all that we're doing to vie for vaccine, but we know that the Federal Ministry of Health released a press, they had a press release about the government of Russia giving them the vaccine or samples, and I'm not sure how that much is true. I hear they've corrected the statement. But what we would say is that it will not be wise at this time for us to take any vaccine that has not been through the phase 3 human clinical trials.
All
That's
right.
that's the position of those of us here in the Association of Nigerian Physicians in the Americas,
All
because
right.
what would happen is, in the past, when stuff like that has happened, it has caused more dangerous and deleterious effects, and it will decrease the trust that the public have for taking vaccines. You
Dr.
want to make
Chimeka
sure it's
Anyanwoke,
complete.
thank you so much. I
Yes,
really
ma'am.
wish we had more time, but the corrected statement was indeed that the samples were still with the Russian ambassador, and what we had was a memoir of the contents of that vaccine. But we really appreciate your time. Thank you for lending your voice to this very important issue. Dr. Chimeka Anyanwoke, an infectious diseases specialist, thank you for joining us.
Thank you. Thank you for having me.